Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Spontaneous fistula closure and the factors which are preventing it. So the answer is in terms of high output. So in terms of high output, that is greater than 500 ml. This is per 24 hours. Then comes the presence of severe disruption of intestinal continuity. So there is severe disruption of intestinal continuity, and that is nothing but greater than 50%. This is of the bowel circumference. Next is the presence of the active inflammatory bowel. So this active inflammatory bowel. So this disease is of the bowel segment. This is of the bowel segment. Next is the presence of cancer. Then there is radiation enteritis. Then there is also the presence of distal obstruction. There is distal obstruction. There is undrained abscess cavity. Undrained abscess cavity. So let's recap what we did. So in terms of the high output, that is greater than 500 ml for 24 hours. Severe disruption of the intestinal continuity, that is greater than 50% of the bowel circumference. Next is the active inflammatory bowel disease. So here, this is of the bowel segment. Next is the cancer, the radiation enteritis. Then comes the distal obstruction, as well as the undrained abscess. So this as well as the undrained abscess cavity. Next is the foreign body. Next is the foreign body. This is in fistula tract. This is in the terms of foreign body. This is in the fistula tract. Then comes the fistula tract. The fistula tract, it is less than 2.5 centimeters long. Fistula tract is less than 2.5 centimeters long, as well as there is epithelialization. So epithelialization, this is of the fistula tract. This is of the fistula tract. So to recap this part, the foreign body in the fistula tract less than 2.5 centimeters long, as well as in terms of epithelialization of the fistula tract. To learn and grow daily like this, please do subscribe.